All right. Well, this week on Wait You're Mad, we're talking about something that feels both intriguing and intimidating for a lot of millennials: med spas.
Because for a lot of us, aesthetics live in this weird space between self care, science, social media, and whispered conversations with friends that start with, okay, don't judge me, but
We see Botox, filler, facials, and weight loss treatments all over TikTok and Instagram. But behind the filters, trends, and myths, there's a whole team of real people working together to create personalized experiences that actually make sense for real life, especially us Midwesterners who are so practical.
so today we're joined by two incredible women from Nova Med Spa, a Midwest based med spa with locations in Ankeny, Dubuque, and their newest opening in Polk City. Dr. Emma Culbertson, DNP. Oh my gosh, I can't even say all these. Dr. Emma, we're going to call her, is Nova's aesthetic nurse injector and medical director, known for her whole person approach to aesthetics, blending advanced injectable treatments with functional medicine, hormone support, and long term treatment planning to help clients look and feel their best in a very natural, thoughtful way.
We're also joined by Paige Trenel, one of Nova's licensed estheticians who specializes in results driven skincare and personalized treatments that turn self care into a truly confidence boosting experience. Together, they represent what Nova does best: combining medical expertise, teamwork, and a genuinely welcoming approach to aesthetics. Welcome, Emma and Paige, to the podcast.
Yay. Okay, Emma, you got to say your whole title because I know you worked really hard to get that and I want it to be there. I just couldn't say it once I got to it.
No, it's totally fine. Technically, it's Dr. Emma Culbertson. I have a Doctor of Nursing Practice, so it's a DNP. And then behind that is ARNP-BC, which is just like an advanced nurse practitioner.
Oh, yeah,
That's
she's
not
like, no
just.
big deal.
She says, goodness. Well, before we get into talking about treatments and some of the myths, let's start at the beginning. Emma, Nova Med Spa has a really unique origin story. Your mom is the owner. Can you tell us a little bit about how Nova came to be?
Yeah, so my mom, when I was just really young in grade school still, she had this dream to kind of blend art and science together. It was really what I would say is the birth of real true medical aesthetics. There was like estheticians and nurses, but there wasn't a lot of aesthetic nurses. In her patients that she saw for facials, she saw them and thought, I could do more for you. And so then she went on to get her nursing degree and kind of blended those two together, and the rest is history from there.
Wow, how long ago was that, if you don't mind me asking? Not to age your mother or anything.
She looks great for her age, so it's okay if we age her, I think. No, she started everything in 2012, and then probably it was around 2020 that I joined her, and at that point, it was just me, her, and a front desk. And she had really grown quite a lot on her own before I ever, of course, like joined her. But she had just gotten the building in Ankeny, and that was her first kind of like big push. And I'm sure she was really scared. So she's put a lot of love and effort into it. I know you guys haven't seen it yet necessarily, but this is kind of like our flagship location. So it's got several treatment rooms and a sauna, and it's really been a little labor of love. So when I first joined here, that was really before they had any of those things. And then from there, we just grew as it needed. We would fill with patients, and patients loved what we were doing, and we loved doing what we did. Just needed to find more people who could kind of do that as well.
Full disclosure, I am a Nova girly. I go to Emma actually. I love Nova. I spend all my money there. And I actually did get to visit your Ankeny location one time when I wanted a laser treatment, but we didn't have it back in the Dubuque location. And it is so nice and relaxing. I told Maddie someday we'll have to do a spa day when I'm visiting her in Des Moines or something like that. But out of all the times in your chair, I guess I never did ask, did you always know you wanted to join your mom in this field? When did you figure that out?
No, I didn't really know. I mean,
No.
who really knows what they
Yeah.
want to do? You just figure it out, right?
Mhm.
But I knew that he really loved helping people and making a difference and making people feel the best that they could be. So I started with nursing. And then even in nursing school, I thought, oh, I'm going to go on, I'm going to do these things. And I want, the more traditional path, if you will. She said, why don't you just come in and watch me for a day? Just see what you think. And I did. Admittedly a little skeptic, but I did join her. And I just saw how much of a difference it made. It's not having people look or feel better. It's not vanity necessarily. It's just, it makes me want to like tear up.
But that means you're in the right field and it matters, it shows that you truly care about what you do.
Yeah. Because there's been so many people whose lives are really affected by it. People who have been in, domestic abuse situations or things that are really traumatic and they have long lasting scars, both, internally and externally. And there's things that you can just help people really feel great about where they are putting down that load, something that they've had to carry. They don't have to carry that anymore. And it's a very transformative experience. Once I saw that, it really just opened my eyes, and now that's why I've started to blend functional medicine with it as well, because I think I'm having a similar feeling that she had with art and science of there's other things I can be doing for people.
I'm going to backpack off of what you said about, aesthetics is kind of labeled as like a vanity thing. But yeah, I mean, I've had clients who have been in like car wrecks before, you never know what kind of situation's going to walk through the door. We do have a lot of clients who just want like, a little boost here and there. But then we also have those other clients who are truly looking for something to make them feel like themselves again. And that's probably like the best part of our job.
Yeah.
For sure.
That's something I never really thought about because I'm sincerely there for vanity. So I'm like, make me look younger, but that's so touching and so important, even for people that are there just to like feel their best self. That's still an important mission to make people feel confident in their own skin. However, you speak of situations like that, and it's seriously something I've never even considered to be one of the most important things of your job. It's so important.
Yeah, it's a super important aspect, but so is the, looking good and feeling good. I think that that's mental health. That's the same thing as taking a shower or going to the gym. Those are just things that make you feel your best, and those are really important for your overall well-being. So, even when it's just for vanity, there's a deeper purpose.
When you say that you are getting more into functional medicine, what do you mean by that as somebody who has no idea the verbiage of the medical world?
Yeah, functional medicine or functional health is essentially blending. I want to be very careful about how I say this because it's a lot of things to a lot of people. It can mean so many different things. And that's why when we started talking about how we would incorporate that into the business, it was what term should we use? How will people best understand this who aren't versed in what we're versed in, but also so it doesn't seem woo-woo or what it isn't, I guess. And so really the way that I practice that is by trying to incorporate a whole person approach and looking at people for whatever they may be dealing with or struggling with, looking at what's the root cause of that and helping from there. So that could be supplements, lab testing, hormonal care, that could be gut testing, GI health, um, you know, breath work, meditation. It's everything all encompassed together.
Well, that is so cool.
I know we'll dive a little bit into that later in some of your newer offerings, but yeah, I feel like that's something that really stands Nova apart from some of the other med spas and how your team really works together to maximize on the experience and give your customers the best experience possible at all of your locations. Can you talk a little bit about how that works?
Feel like it's very typical that clients will first come in to see me as an SD. Like that's where they'll start because, that's like an easier way to start for a lot of people. It's not as nerve-wracking, to come get a facial or, they already know quite a bit about that. And so people will typically, start with maybe like a consultation with either of us, but then usually we'll start them out with like a facial just to kind of get into what we do here a little bit. And then when it comes to the two of us working as a team, there's a lot of times where I will have a client who, and let me preface, like as a licensed esthetician, my scope only goes so far. But with that said, there's a lot of times where someone might have an issue and I can recognize that something that's showing up on the outside might be caused by something on the inside. So that's where I can team up with Emma and come up with a plan of care for this person. A lot of estheticians are stuck referring clients outside of their practice, so like to doctors or to dermatologists, where I kind of have the advantage because I have a doctor right here. We can kind of just work together and create a plan and just kind of team up. And it's great.
Yeah, no, definitely. I think that continuity of care is a really important thing. You see your primary care provider, and they have to maybe refer you to go see your rheumatologist. Everybody has that referral, and then you get to the rheumatologist and they say, oh, okay, so what are you in here for? And we don't have as big of a gap to bridge because she's right down the hall. So if she can tell me word for word, and I can obviously see the charts as well too, but she can tell me from her, first person experience what I should be looking at or what she's looking at.
Very cool. And I'm sure a lot of clients don't know that like those conversations are happening behind the scenes about them, who's best fit to treat them or what treatment is best for them.
Well, I tell clients a lot, if there's ever a question that you have and I can't answer it, I have a team here of a doctor and nurses and other people who can answer that question.
Every team member at Nova, we're a bit of pit bulls. I think that if we don't know the answer, like we're going to seek it out. We're going to find it. So even if our whole team doesn't know, we're going to go research it. We're going to figure it out because to us, every client is a friend, a mom, a sister, a brother. It's somebody who we admire and we really want to help. So, the same way you would research something for, somebody that close to you, we're going to do the same.
And it's essentially a family business. And your mom is probably definitely, like you said, a bulldog. She had this vision in 2012 of this business when like there was not just a med spa on every corner back then. So that is a visionary to go into that business then. So that is
Yes.
And to speak from someone that's gone through the customer experience we're talking about, I actually started with your mom, Sarah, my very first time. I mean, you know me, I'm so scared of everything. She did such a great job at leading me like education first, making me feel so comfortable, not forcing me, like giving me my options. And I feel like you guys have done such a good job of instilling that culture consistently throughout all of your team members. I guess I've had a chance to go to quite a few of you, and you're all just the same kind-hearted. It's like more about what fits me best, what fits my budget best versus like what, making money off of your customers. So I just really appreciate that about you guys. And also knowing that I can trust Emma to tell me if I don't need something. She's not going to push me into paying for services that I don't need as well. So I think that's something I just wanted to give you guys a shout out for.
Appreciate that.
Yeah.
My mom, Sarah, like you said, she's a visionary. She's the matriarch, bow down, She taught me everything I know. She's the best. She really is. She's so good at what she does and she makes it look easy. And I think when we rebranded to Nova, like several years ago, before it was Radiant Skin, and when we rebranded, it was a bit of, we were having this surge of energy, if you will. We were rapidly kind of growing. So we thought, what does that? And it's a Nova or supernova. And that's really she was thinking that's what we're doing. And I was thinking that's what she is. Everybody, just like the sun, like everybody orbits her, So yeah, she's incredible.
I worked for a franchise. I worked for a big corporate company in the past. I feel like the biggest difference that I've experienced is I feel very heard. And, when you're working in those big corporate companies, it's hard to get your ideas seen. Like here, we're all dreamers. Like you said, Sarah, we're all visionaries. We're all dreamers. And we always come up with these really big ideas. And I'll like sneak into your room and be like, Emma, you have to hear this. And we'll just like bounce ideas back and forth. And working with other companies I have in the past, I wasn't able to do that. It's very hard to have an idea or want to change something and have that be heard from the higher ups. But here I'm able to do so and able to share my ideas and, be a part of a team that is constantly growing and renewing. And it's just really cool to be able to do that with such beautiful and powerful women.
That speaks volumes to like work somewhere where your voice is heard and you feel like you can make a really big impact. I love that. And I love that that's how you got the name behind Nova.
Are we ready for the myths?
I'm excited about the myths.
There are so many myths surrounding aesthetics, especially with social media being so prominent. Let's talk about them. Do you have any specific myths that you consistently hear, whether it's on social media or from your clients who walk in asking you particular questions about Botox or about fillers?
I remember seeing one on TikTok a long time ago that I actually shared with everyone in the spa because it just made me laugh out loud. But it was a speaker in an audience, and they were talking about how Botox goes into the empathy center of your brain. And so that's why, like, you get Botox, you don't have empathy anymore.
Yeah, and that's well,
One of the
listen,
crazier myths.
it is definitely one of the more far-fetched. I think what that stems from a little bit is that essentially when you're getting a neurotoxin, you are going for a relaxation of that muscle. And so sometimes what can happen is people end up looking a little bit frozen, if you will, or lacking expression. And so when that happens, I think that that's the response is you can't show angry as much. You can't show you're sad as much. And it's received that way as well, too. So when they have less expression, then you're going to receive them as maybe not being as affectionate or loving, or they can't show me that they're sad in this moment. And so I think that's where maybe some of that empathy comes from, people saying that, but it definitely from my knowledge, is not going into your brain and affecting your empathy center.
I remember seeing that, and I remember LOLing at the comments in it too, because everyone, like all the Botox lovers, were commenting saying like, "Well, I guess I'm a bitch then."
Which
That's fine.
actually, I've heard that Botox can help with depression. Now, have you heard anything about that?
Yeah, I have heard. I just think it's really hard to say. I don't wanna make any claims one way or the other, but I think people find a lot of support from it in many different ways.
Yeah, I mean, it helps with headaches in some cases. I mean, there's quite a few ways that maybe that could lead to not being depressed, not being in pain.
Am
Yes,
I
not
less depressed when I have Botox because I look better and glowier, or is it actually scientific?
It's hard to say. It does feel so good.
I think it helps with a lot, if you're not in chronic pain, then that definitely can make a big adjustment. We treat trap muscles, we treat, platysmals, TMJ. There's lots of different things you can do with it.
Yeah, I think part of the myth of Botox and fillers too also has to do with what region you're from. I think the Midwest has a very negative perception. Not it's getting better, but like more so than other areas because of the trends that are going on in areas where it is super, super common. Do you want to touch on that a little bit?
Yeah, I definitely can touch on that. I think that people here think that if you get a neurotoxin like Botox or Dysport, that you look like the really fake people on the coast. Like you look overdone. You look like these things. And that's just not true. I tell people all the time, the grandma walking down the street who's 65 that like you think looks great but looks her age, she's got Botox. The dad going to get his kids from soccer practice, he has Botox. Like everybody gets it, and it's a good thing if you don't think that they look like they have it. That's the whole.
This is exactly what happened to me. So, all of my friends, their skin looked so good. And I think this was probably like 4 years ago. Finally, I got it out of a couple people. I had no idea anybody around me was getting Botox. I started hearing, oh, I get Botox. Oh, I've got Botox recently. Or, oh, I've had it for a couple years. And I was like, oh my gosh, this is the secret. I had no idea that everyone I knew was getting it. So, it is true. Everyone's getting it, even if you have no idea.
I was gonna say, I think that it wasn't always so mainstream, like Botox and fillers were something, like you said, like A-list celebrities were getting them, and it was very like West Coast or East Coast. And but I feel like now it's a lot more mainstream and people are just more kind of hush about it. They're not like, oh yeah, I get Botox, oh yeah, I get filler. It's just a lot of people are doing it. They're just not talking about it. And yeah, it's just kind of hidden a little
Yeah.
bit.
And I think like the style of it is a little different regionally as well, where we look at the overfilled lips in LA right now, where, yeah, us Midwest people are like, no, we want it to not look like we have filler at all. So I think that's where another misconception comes from. Emma, I think we talked about that before.
And that's probably one of the myths that people believe. People think if I've never had lip filler, I'm gonna go in, I'm gonna get lip filler one time, and my lips are gonna look like hot dogs. They're not. It takes so much filler to get to that point. So much over repeated times of getting it. And just, not having the eye to be able to tell you. I'll tell you if I think that they're getting too big, we'll have an honest discussion. Like, hey, let's reevaluate. I'm not going to let you get lip filler blindness. I will help you.
The
Or if this is the look you're
blindnesses.
going for, all right, let's do it. Just wanted you to know.
Discussion here.
I think that's what your mom said to me when I was first interested in Botox. She's like, I don't freeze faces. That's not my style. I don't want to. I guess if you really, really wanted me to, I would for you, but I'd prefer not to, kind of thing. And
Yep, exactly.
I loved that.
One misconception that I've heard quite a bit, and you can tell me if it's a myth or not, but I do hear older people say, oh, that person's way too young to get Botox. Is there a particular age where you don't recommend versus recommend starting getting Botox?
So I'm not going to be fun for this podcast at all because I don't have any shocking of, no, you have to be older than 30 to get, I don't have anything like that. It's really just patient dependent. Some people are in their mid to upper 20s and they have significant movement and they're already having skin breakdown where you can see, some of those, I call them, they're called static lines. So lines that when you're not making an expression, like if you made that surprised face and you get these kind of static lines that you see when you're not making that, right? So your makeup gets trapped in, things like that. Those are lines that obviously you don't want that skin breakdown. So then if you could benefit from a neurotoxin like Botox or Dysport in that area, you would be a good candidate. But that could happen for people at many different ages in their 20s, 30s, 40s, up. I think that the misconception is that you need to already have a wrinkle or line to treat. And that's not true. There is the world where you don't have it yet, but you can see. I can see if I keep making that muscle movement for 5 or 10 more years, I'm going to have a big line in my forehead there. So then, yeah, you can preventatively treat with a little bit there to make that soften a bit so that doesn't happen. But I think that where, to their credit, people who are trying to guide us are thinking, you don't need to augment yourself to look different. You're young, you already look great, and that's a compliment. They're trying to help you. So they're not coming from a bad place, but they just don't know.
Another myth, I think, is that men don't get Botox. Is men's skin a little bit different? Should they handle getting Botox a little differently?
Not necessarily. I think the same rings true for what I just said about age before,
Okay.
is that it's just really patient dependent. I will say, doesn't matter if you're, what your gender is or how you identify, whatever is that you're going for, that's usually more what we focus on. If you want, you're chasing a more feminine look, you're chasing a more masculine look, there's different ways that I can help the face express where you can get a little bit more of those, feminine angles typically are a little bit more upward, raised to the lateral canthus of the eye. So like this outer corner of your eye to be a little upward tilted, the brow to be a little spiked towards the edge of it, that foxtail lift. Those are all things that give you a little bit more of a feminine sometimes. And men, the only difference is that if they would like a masculine look, the treatment plans and things are a little bit tailored more to achieve that.
I think we
That's
also
so
have a
interesting.
couple of, like you and me, share a couple of male clients who get Botox, but they specifically will leave like their 11s alone
Yeah.
or something. I know we have one client that calls it his dad face or his
Yeah.
angry face.
Yeah.
Can look mad still,
Yeah.
but he still gets Botox. So
Yeah.
You can pick and choose. Just like you don't have to Botox or you don't have to, relax the expression on your whole face. If there's one area that bothers you or you have really deep, people call them, 11s in between your eyes here. If that's really deep and creating a line that then that's all you see, you only look angry. We can soften that too. So it just, whatever your goal is, it can be achieved. And that's a common, misconception or myth. People think you're only going to look one way when you get treated, but you can soften, you can treat just your eyes or just your forehead, you can treat your low face. There's so many different things you can do.
So if you see a man with that upward turned eye that you think of kind of like they definitely did not go to you, number one. But
Yeah.
you think of that feminine look when you see those older men kind of come out looking very different one day. That's interesting. They didn't specify that they did not want to look feminine.
I think it's part of Your role as an injector, though, is always asking what somebody's goals are and making sure if somebody would like a more masculine look or they would like, I treat laser as well and I'll do BBL, Moxie, things like that. And I always ask people, BBL will take away freckles, sunspots, things like that. I always ask people, do you want to keep this freckle? Some people really love teeny tiny freckle above their lip or here or there. So it's not my say how you necessarily want to look. I'll help guide you, within reason of proportions and things like that. But it's your look and I just want to help you achieve it.
Okay, so when people come in, do they do you see a lot of people referencing like social media trends and things like they're seeing online? And if so, does that help or hurt you guys in the aesthetic space?
I feel like that is really common. I feel like a really common one we see is the Hailey Bieber lips. People come in and ask for that all the time, but it really depends on, I know for you, like anatomy and like what's going to work best for you. People come in, for me, they come in for brows and they'll show me like this celebrity's brows. And I'm like, it's just quite literally impossible for me to do that for you.
Oh my God, can you tell me more people that people want to look like? This is so interesting to me.
Oh, that's a good point. I get Pamela Anderson a lot, like Pamela Anderson when she was young.
Really?
Maddie, who would you say? I think I would want to look like Madeline Klein. Like, give me her lips.
Oh, gosh, I don't know. I've never thought of this. You'll have to come back to me later.
Hate you.
I want to look like the
You're
best
not fun.
version of me, okay?
I knew she was gonna say some bullshit like that.
It's total bullshit.
Well, whatever. But speaking of keeping things proportional, we've talked a lot about Botox, but what do people misunderstand the most about filler?
That's a good question.
I think one that I've seen a lot is that people think that once you inject filler into you, it never leaves and it just spreads throughout your body and stays there forever. Um, which obviously you can speak for. That's not really how it works.
Yeah. Yeah, there's so many misconceptions about it. And, we're learning every day. So something I say today might not be true in a year. It's just that's science. So I can tell you what I know now, can tell you how I treat. But if you went to somebody else, I may not know their technique or what they did or where they placed it or how they placed it. So it's really hard for me to say that you couldn't have some of the things that I hear, There's those cases for sure. But I will say, I think one of the more common misconceptions I get with filler is that it's a lot. If people say, if I tell somebody, let's do 3 syringes, that would be more of a full facial balancing plan for me, where we can get cheeks in there, maybe a little chin. We could maybe touch up the lips or do nasolabial. We can do a few different treatment zones. So if I told somebody that, and they'll be thinking they're going to look like, I don't know.
Like Donatella Versace, is that who you said?
That's who came to mind.
Like, that's what I think of. Or the housewives on Beverly Hills or the OC, like if they look okay because they're in a group all together on television where they kind of look similar. But I think if we saw them in real life, we'd be like, hold up. Like,
It's an
this
intense
is a
look.
very specific look.
Yeah. Yeah, you are not going to look like that from 3 syringes. Typically, obviously, everybody's anatomy is different, but it takes a lot to get to those points. Those people who you see on TV, they've had facelift, neck lift, 4 syringes, 5 syringes, 6 syringes. Now we've got, a laser. It's nonstop all the time, and it builds upon each other. But it's surgical, it's non-surgical. That is a look, right? And they execute that look really well. When we watch them on TV, they look great. I mean, they look great. But if that's not what you're going for, you don't have to worry that 3 syringes is going to get you there, because it's definitely not. A teaspoon is 5 mLs, and a full syringe of filler is 1 ml. So
Yeah.
it's such a little amount of filler that we're actually placing. It's just how strategically it's being placed and where it's being placed to get the look. But it really is not a lot of volume that you're placing most times.
I think I saw online somewhere that one syringe is like the equivalent of a blueberry if it were to make a ball or something like that. Is that true?
Yes.
So,
Yeah.
but you're spreading it out. You're doing what you do. I don't know. I don't know how you do it, but typically, I know it like probably depends on the person and the type of filler too, but typically how long does filler take to dissolve on its own or metabolize or whatever it does?
Sorry. I don't know why that made me giggle the way you're saying
Whatever the hell it's doing in there.
buzz in there when it gets in there. I don't know.
When you do what you do, it's there. What does it do next?
Done what you do and you place whatever that is in my body.
Yeah.
No, as it kind of breaks down, it just depends per each filler and how much was placed. So filler has different properties to it. So some filler is really quite firm, some is soft, some is like what you put in your lips is very soft. When you have filler in the lip, it's meant to mimic lip tissue. I could not put that lip filler in your cheek because it's not going to give you support like a cheekbone would look, right? They're two very different things. So it depends on how much you're placing, what type of filler you're placing. But typically, on average, filler has a duration of about 6 to 12 months.
I feel like it depends too on the person because, like, I could speak for myself. Like, so, like, I don't hold filler as well as other people do. And so it just, my body eats away at it and love to get it done a little sooner than other people do.
And not just the type of filler in general, it's the type of filler for the patient. So I've had patients where I tried 3, 4, 5 different types of filler until we found the one. Okay, that one holds for you. And it's just kind of aligning those different properties. But generally, lips, it just depends, like I said, how much you're doing. But if you're doing anywhere from a half to a 3/4 syringe of lip filler, you're probably gonna see maintenance, maybe every 6 to 9 months, depending on how you hold it. If you're doing your cheeks, maybe you'll do those once a year. So it depends on the look.
A lot longer than I expected, honestly. But I've only done Botox before. So that goes so fast. It's gone. It's gone.
I know. I feel like I burned through that, but it's probably because I'm always frowning.
Well, no, it's not.
I want to know what you're really going to say.
But that's good to know.
I was going to say that there's a lot of different elements to that. It can be if you have a little bit higher metabolism naturally. Some say if you work out a little bit more, you can run through it a little bit. Recent studies to support that those taking or using the GLP-1s, because that increases your metabolism a little bit. It also increases how fast they're going through their Botox and Dysport. So yeah, there's some studies that support a little bit of all of that.
Gotcha.
One of the things I hear a lot from social media, different apps, is people talking about how skincare is a scam, that not everybody needs skincare. People back in the 1800s didn't have acne. So why are we using these chemicals on our skin? We don't need them. First of all, people in the 1700s definitely were getting acne. I can say that for sure.
They just had paintings done that
Yeah.
edited it out for them. They weren't photos. They were
They
paintings.
didn't have high depth iPhones that actually over sharpen every imperfection that you have.
Why is there no acne in the paintings?
Yeah,
Paid
come on,
for
guys.
extra for them to edit it out.
Yes.
I blame them for making us think that acne is ugly, even though
I think what the biggest misconception is like there's so many things that are trending. And so when you see somebody who's really big online, who has these millions of followers, and they're getting paid to promote these products, or maybe they're not, and they just have a product and they swear by it. They say it cured this, this, and this, and it worked so well. Just because it's going to work for one person does not mean that it's going to work for everybody. Everybody's different. Everyone's skin responds differently. So every approach, like your approach to your skin needs to be tailored to you. So you can't just like buy all these trendy products and expect them to like cure you. And I think that's why people think it's a scam, because all these trendy products, they're buying them and they're not working. And so it's just, you need to tailor that.
You need to come talk to us.
You need to come talk to us. Like, we got you. Just come in. It'll be fine.
The reason why is because when you come in, we're going to look at what your skin needs. I can see if you have inflammation in the skin. I can see not just dry and oily, right? I can see if it looks like there's a bit of a histamine response or an allergy kind of underlying there. So all of these different things. And then I also know, and Paige knows, that's why you come to see us, is that we're trained to be able to see this is what I think that would help with, right? So if I'm going to help you with azelaic acid, or I'm going to give you peel pads for home, or whatever it is, we can help tailor that. And so where she's saying it's just not a one size fits all. And on social media and everything we do, we want that instant gratification. You want that one product that's going to change it all, because I don't want to wash my face and do a 3-step routine every single morning and night. I don't have time for that. But sometimes that's the hard truth of it, is you have to go through a bit of that to get to a good baseline before you can back off of it a bit.
And it's really important too, I think, to be able to identify your own skin. And that's a really big part of our job. We're not just selling you things, we're also trying to educate you on how to recognize things for yourself. So, like, what skin type do you have? Do you have dry skin, oily skin? So you know how to shop for yourself and you know what to look for. And you can recognize, like, okay, I'm seeing this in my skin. Who do I need to see? And so you're not just buying anything you see online and hoping that it works.
Okay, I'm coming to you immediately. Like,
Yeah. Did
I
I
am.
did I see you guys posted recently about the myth of medical grade products just costing so much more than products that like Ulta or Sephora as well? That's kind of like another myth out there.
Yeah, I always tell people I think of it as medications, which is probably just how my brain is wired to work. But if you were to go and get a product, let's say you get a hyaluronic acid from Target, and then you get a hyaluronic acid from a medical grade MedSpa or whatever it is, you're getting a medical grade product. The difference in there is the purity. So you're not just getting a 2%, 3% hyaluronic acid that's not doing anything for you. You need one that has a 40, 50, 60% that's enough of a medication dose to see a result. If you took a quarter of an ibuprofen, it's not going to get rid of your headache. You have to take the actual dose to see the results.
Ladies, what is the deal with salmon sperm right now? Can you just tell me?
I literally sat in Emma's chair and asked her that question a couple months ago.
Super, super trendy.
Is this real? Is it not? Is there like a trace amount in these, like, for instance, one brand is it Medicube that's all over right now? And is there like, how much is in it? Is it really salmon sperm? Like, what is this?
I feel like it's so hard to say. So it is salmon sperm. That is where it comes from. I feel like it's so hard to say because it's so new. There's still a lot of, research being done on it. It is part of, Korean skincare. That's kind of where it came from. And they've been using it for a really long time.
No, I think that there is a lot of really great things emerging in aesthetics right now, and that a lot of them have potential to be great. And I'm just a research girl. I just want to see it for a long time. And it has to prove me. I'm a skeptic. I want to see that it really stands the test of time. Not to say that it doesn't, but that's just what I would like to see for a few of the things emerging right now. But there is lots of science to back these things that they work. And I'll tell you, I've had experiences with medications myself with patients where the science says this medication should be better than this medication. And I give them both to the patient. I tell them, hey, this medication is supposed to be better, so let's start on that one. And it doesn't do what it's supposed to do. So we start them on the one that isn't supposed to be as great, and it does a wonderful job. Everybody's just so different. So I just like to see it in the patients themselves. There's a lot coming out with PDGF and PRF and PRP, and they all are great in a growth factor realm. How to utilize them best is still being discussed. So I think that I'm excited to see where it goes.
That's kind of what I was going to touch on is, she said something about the Medicube products. And what I'm kind of waiting to see research-wise is it better to use it as a topical product, or should we be doing it paired with other treatments like microneedling, or, should we be getting it deeper into the skin than just on the surface? Like, where is it going to work better? Which layer of the skin does it need to be to do its best work?
PDRN. That's like the PC way to say
Yeah, so
salmon
you don't
sperm.
have
The
to say
scientific way.
sperm, Maddie.
Hey, I think I just said it because everyone's thinking it.
Yeah.
Yeah.
Well, it's true. How did we find this out? Who?
They just have to fertilize eggs and the eggs are out. So who knows? So I bought the little pad things, but I'm like, salmon sperm. My dad put some on and everyone at Thanksgiving's like LOLing.
I
This
think no matter
funny.
what it is, there's never a one answer is amazing. Like, oh, salmon sperm's going to change my life. It's probably not on its own anyways. It's going to be mixed with a bunch of other things, right? Like a good skincare routine, coming in for some medical aesthetic treatments and all of those
Mhm.
paired together. Nothing is like going to change your life.
So, we're going to talk about a very hot topic right now. Nova has also expanded into weight loss and hormonal support, which is something people are super, super curious about. Can you tell us a little bit about your offerings and why it was important to add these?
Yeah. So initially, it just started from a place of need. Like I said earlier, a lot of our patients, we've had them for years. So I started hearing women say, specifically, we see women, like I do men's health as well too, but it started with women talking to me about, I just feel like crap. I don't feel good. I have no energy. I'm angry. I kind of want to kill my husband. And I just wanted to help them. And I knew that there were these things not being talked about, like hormones and functional health and gut health, and that they could really make a big difference. So we, with the help of another nurse practitioner at the time, kind of brought that on. And it was not something that we necessarily marketed. We brought it on because that nurse practitioner had a lot of experience with it, and she was able to kind of just help the patients, if you will, and fill that need. But we weren't thinking this is something we want to grow. So we told those that we loved, hey, we can help you with that. We have somebody who's really experienced here, but we didn't like push it necessarily. And then everybody was like, hey, I don't feel good. And just opening up more. It really was patients opening up and being authentically themselves and transparent with us because we have really great relationships with them. And that's where, Lexi, you were saying earlier, I will never tell you that you need something that you don't need. That to me is the most important thing for my patients to feel that way, that they know I'm going to look out for them and I have their best interests at heart, because then that's what happens is then you're opening it up to me about wanting to kill your husband and I'm able to offer you some progesterone to calm down a little bit. And that's really what it all stemmed from. So now we do hormonal support, like bioidentical hormone therapy. We do full hormone panels, functional health, vitamin testing, vitamin support, like injectables. We also offer oral supplementation. We do a little bit of gut health through food sensitivity testing, allergy testing, lots of guidance, lots of health coaching, really just whole person approach. And that's what functional health is. It encompasses all of those things. So
Oh my gosh, so impressive. I think honestly, I don't know if you'd be surprised to hear this. I'm sure you would not be surprised to hear this. I've had at least 10 people come up to me and say, Maddie, you know what you should cover on your podcast is perimenopause. And I've never heard this word as much as I've been hearing it lately. Is that something that you're seeing people go through? And is this kind of aligned with that? That these are things that could maybe help somebody who could be going through these situations and having these symptoms?
yes, for sure. Women are being so brave right now because they're talking about it and they're pushing for it. Recently, there was a lot of push for it with the FDA as well. The black box warning was a warning for a lot of physicians to see that and think, that's not something that I want to mess with. I don't want to mess with your hormones. I don't want to do that. That can have really bad outcomes and I'm not going to mess with it. And so they just didn't hear women. And a lot of women, I've heard time and time again, were prescribed anti-anxiety medicine, antipsychotics for perimenopausal symptoms, for menopausal symptoms, and they're not being heard. So all I try to do is listen and listen for key things that I know. Oh, I think a little progesterone. If it's done well and it's managed well, it can be really, really safe and healthy in a lot of ways. It can be cardioprotective, good for your heart. It can be good for your bones, your mental health, your sex life. It has a lot of pros.
You want it all. That sounds
Yeah.
great.
I hear women complain all the time about having some sort of imbalance hormonally and going to doctors, and they're always like, get on birth control. That's the ultimate way to quick fix everything. And so it's nice to hear someone that's really looking at it holistically and finding a different approach for that, because I know women are fed up with that option.
And thanks for speaking out about it and saying this because I feel like people don't know that this option is out there.
Yeah. No, I think so many people don't know, and they don't know that it's right in their backyard. Like, you don't have to it's more fancy. You don't need a fancy referral. You can just come see me and we'll chat about it and then go from there. But I also think that there's a bit of a surge right now in women's health and in women's hormones where everybody's thinking, oh, it's just my hormones. I just need to get on estrogen. I just need to take it. I just need to get that. But it is something that should be well managed, and it is something that there's a lot of other ways we can support your hormones. So I don't want to simply support your hormones without supporting your stress, your inflammation, your sleep quality. All of those things together support how well your hormones function. Your vitamin D. We have no vitamin D. Everybody in the Midwest just has no vitamin D. That is not a medical statement, but virtually none. And that helps support all of the production of our other hormones. So when you really are able to look at things from a whole approach and support them from more than that, maybe we don't need hormones, or maybe we do, but we need less. So it gives you a lot more options.
Wow. It's amazing that you're able to approach these conversations in that non-judgmental way, that you just are giving off that vibe right now. And I'm sure that it's not always the easiest conversation to have, and it's amazing what you do. So thank you for being an advocate for women and men too. But
Yes. Well,
Mostly us. We're selfish.
honestly, I know I love my women, but I will touch a little on the men because there is, that is a thing that I'm seeing as well, is that a lot of the men, people are just like, oh, you don't have as good as a sex life, boo hoo. No, there's a lot that comes from that as well. Testosterone helps with fatigue and brain function and all of those things. So there's a lot to say for men's health as well too. They just historically have a little bit more support.
Yeah, I'm not even gonna dive into that one, but yes, they do. Okay, are you guys ready to play a game? We're going to play Trust or Trend. So how this will work, we'll name a treatment, behavior, or situation, and you tell us if it should be driven by trust or trend and why. Okay, are you guys ready for the first one? Let's do full face filler done in one appointment.
I think it can be both. I think it should be driven by trust. If you have an injector who you really trust and you love their eye and you trust that they're, how they're going to make you look, then go for it. You can do a full face of filler in one appointment. There's no problem with that at all. But if it's, driven by trend, or you're chasing something and you don't really know what it's going to look like and you don't have all the knowledge, then
okay,
That's a good one.
kind of similar. Facial balancing versus treating one area.
should be always driven by trust and just determining like what's best for you, but not a trend at all.
Let's say starting Botox just because everyone in the group chat has it.
You should do something because you want to do it. So don't do something just because it's a trend.
Is there anyone you've ever turned away for Botox? Like, have you been like, no, you don't need it? Or
I want to touch on this because it just reminded me of it with Emma specifically when I very first started working here. And I was actually in this room with her, and I said this as kind of a joke after the open house, but I looked at her and I was like, so what's going to make me have a better jawline? Like, what can I do? And she kind of looked at me and was like, no, like, I think that your features, like, you have a round face and a very beautiful face. And she just was like complimenting me. And I had said it as a joke, and she was like, it would be filler, but please don't do it. Like, you have a very beautiful face. Like, I don't want to inject you with that. I think that, you shouldn't. And I'm not gonna lie, like, she sent me home and I felt a little more beautiful that day. And I literally, because it was something I was insecure about, but I wasn't really looking to do something, but she just kind of gave me that reassurance. And I feel like that's a really big part of our care, is like, don't do something because it's trendy. Don't do something everyone else around you is doing it. Like, always choose yourself, and you're beautiful. Everyone has features.
I love unique features. That's why I do what I do. I just want to enhance your unique features. But I think that everybody has a different facial shape. They have, different things culturally that signify different things for people. I love a nose. I just love a big nose. I think they're cute. I think people should just rock their noses because it says a lot about who you are and where you come from. And yes, I understand, if you really don't love it and it really gets in your head every day, then that's saying something. But people should just feel more confident in their natural traits and not have to try to all morph into like one human we see online.
Mm-hmm.
too for me, like, coming in because I came into work at a med spa and I was like, "Oh, they're gonna want me to do all these things. They're like, I'm gonna have to, like, do all these treatments and, like, everything." And no, like, they've always been like, "You're beautiful the way you are. You don't need something. We can, like you said earlier, guide you." But
Yeah.
made me feel a lot more comfortable even just working here.
I love that.
You guys, that was such a nice moment. I love
Yeah.
it.
Okay, back to the game.
Sorry.
I'm just kidding.
Okay. Do you trust it or do you think it's a trend? Choosing a provider based on Instagram before and afters.
What do you think?
I think both in a sense. Think that before and afters, like the way we market ourselves is a huge way. It's how we gain clients. It's how we find a lot of people. And you want to obviously make sure that when you're choosing someone, you like their work and you like the way that they're making their clients look, but also, there's so many new things coming out. There's, AI, I've seen some people who edit a lot of their photos. And so I think the biggest one to go off of is definitely word of mouth, like talking to people who have had an experience there or seen this certain person. I think that's the best way. That's how I have personally found the most loyal clients is through word of mouth. And I think it's not a bad way to find somebody, but I think it could go both ways.
Yeah, definitely don't pick somebody based off of trends. If you're looking at their social media and you feel it's reliable and that it's a good fit for you, then it's a good fit for you and go try it out. Start with a consult and get their vibe and feel it out a little bit more because people can be one thing on the internet and another in person. But if that matches and it aligns with what you want, then go for it.
Great
Awesome.
advice.
I'm going to skip down to this one because we haven't touched on these a lot yet. Monthly facials as maintenance.
Definitely trust.
Trust.
I feel like it's very common that I will get clients who will come in and they'll expect to be like, I'm going to get one facial and that's it. And they
Facial's gonna
expect
change my
like
life.
they're coming in and I'll be like, okay, so what are your goals today? I want to look 10 years younger. And I'm like, okay, we have to be realistic here.
Okay, let's set some goals.
Yeah. So, I mean, change comes with consistency, and you want to. I have clients who have gotten monthly facials and they've told me after a while, like they can tell when they need another facial. You kind of get your skin into this routine. And I don't want to get too scientific, but,
But I will. You guys twist my arm and I'll do it.
But when it comes to like your cell renewal processes, typically you want to be getting that really good exfoliation, that really good detox about every 30 days because it gives your skin that boost. It's going to get rid of all of that dead skin that's on the surface. And it's going to, refresh the skin, give you that nice boost, that nice glow, but it's also going to speed up those processes and help your skin do all of its processes better. So definitely sticking with facials and not even just facials. I tell clients this as well. You can't only rely on a treatment. You have to be doing the work at home because if you're spending all this money on these big fancy treatments and then you're going home and sleeping in your makeup and doing nothing, it's just your money's
Call me out like that.
but it kind of becomes a waste. And we talk about how treatments are an investment, right? And you want to protect those investments. So being very consistent with your skin, going home, doing the right aftercare, the right skincare, and then doing that detox every month. That's how you see the best results for sure.
I can kind of speak to that. We all know I've been getting Botox for a little bit. However, Emma got me doing facials monthly and I signed up for their membership, which you guys can talk about a little bit later, but basically it includes monthly facials. And I feel like it was such a game changer for my skin. Botox was a great adjustment, but the facials impacted it even more and staying consistent with them, especially. So I love them.
Yeah,
And they're so relaxing.
they are. It's a good mental break too.
I look
But
forward to them.
my clients, they'll say, do I really need to go get facials every month? And people that I've treated for years, if you look at their before and afters, you can 100% tell the people who did facials and those who just did filler or Botox. It just makes a really big difference. You look healthier. You look like you're glowing.
Time to book for me. Okay. I'm like
Right.
dreaming right now.
Maddie, why don't you pick like one more?
Yes, I have one. And I don't know if it's interesting to anybody else, but this is very interesting to me because I do it. So be honest. What do you think of at-home dermaplaning?
Yeah, super I actually get this question all of the time. And though, you know, my first answer is going to be don't trust it. Because a lot of times the blades that you're buying at Ulta Beauty at the store, they're kind of what are they called? They're like almost serrated, the tinkle razor. Those tend to be really harsh on the skin and they can leave tears in the skin, like little micro tears that then can get infected, show up as acne. It can be very irritating for the skin. But then I know how people want to be convenient and they want to just like quick do something at home. So I've also said, like if you've been doing this and you haven't had any issues with it, like it's one of those things where it's not a huge deal, but it is best to be done by a professional. I mean, the blades that we use for dermaplaning and facials are almost like literal, it's a surgical scalpel, very, very sharp. And so we're very precise with it and it's giving you that good exfoliation and doing what it's supposed to do without causing any damage to the skin.
That's a really good point. I've literally had like terrible breakouts from like not washing my face and stuff afterwards perfectly. And then I usually come out with like a couple scrapes somewhere, So I didn't know like that this was a professional thing to do.
Yeah, go get a facial and add it on, Maddie. It's amazing.
Oh yeah, I need to. I have like peach fuzz like a mother, so
Yeah,
And when you
same.
do it in a facial, you usually, how she's saying, you come in every 4 to 6 weeks or so. You really only have to do it that often. By the time they see you again, it's pretty much grown out. But when you do it at home, it's just like a close shave kind of. And so it
Mhm.
goes right back out pretty quick.
Another option I feel like a lot of people don't think about is facial waxing. Like we can wax anywhere on your face. We can do your sideburns, we can do your cheeks, and wax is going to do the same thing, but the difference is that it's going to be pulling the hair out by the follicle, not just shaving it. So if you're wanting something to last a little bit longer and keep the hair at bay longer, then waxing is definitely a better way to go. Whereas if you have like an event coming up, dermaplaning is great, pre-makeup, pre-event, really quick solution.
Yeah. And it also helps your product absorb better.
Yeah.
Nice. Cool. Something to think about.
Trust or trend, GLP-1s are a shortcut.
That's not true. It's all that is driven by trust. I trust GLP-1s. I think that GLP-1s hold a really special place and that there's a lot of good that can come from them when used responsibly. People have a lot of judgment towards them and it's silly. I think that's similar to mental health medications or things like that, that things just get a bad rep. And it's really beneficial in so many different ways. It can help with cholesterol, heart health, brain health. It reduces the risk for neurodegenerative diseases like Alzheimer. Just has so many other benefits anti-inflammatory wise other than just weight loss. So a lot of people are doing microdosing of that where they take just a little bit of it to maybe weekly or bi-weekly to kind of help them maintain their weight, but they get all the anti-inflammatory effects. So they feel less puffy, if you will. They feel less bloated. They have less histamine responses, less allergies, rashes. Maybe autoimmunes aren't as severe for people. There's a lot of different benefits that people are finding from them. And when they're used as weight loss, a lot of times they get the rap that they're like just being used as a fad diet or you're going to gain all that weight back. It's just like Weight Watchers. It's not just like Weight Watchers, but you have to do it right for sure. I think there's a lot of people who just go get it online and they don't know the source, and that's scary. Don't do that.
Yeah.
Because there's
Regulated, it's a good thing, is what I'm hearing.
there's a lot of scary places out there selling things that you don't know what's in it. You don't want that. You don't want to get anything counterfeit. You want to make sure that it's from a place that you trust, that it's from pharmacies that you trust and things like that. But also, I'll say when I see my patients, I see them monthly and I will talk to them about diet and exercise and small sustainable changes. So if you have a 50 to 100-pound weight loss that you want to do or achieve, semaglutide, tirzepatide, any of those GLP-1s, they're going to be a tool just like diet and exercises. It's not a magic injection. It's not going to magically make you lose weight and you're still eating pizza and laying on the couch. That's where people are saying, oh, you could just take that and get skinny. You have to put in some work. So
I feel like that's one of the biggest misconceptions as well is that, when I see people talking negatively about GLP-1s, most of the things that they're saying, they're referring to it as if that's all someone's doing. They're just taking GLP-1s. They're not working out. They're eating, they're relying on that alone. And I can't speak on how providers elsewhere in the world to their clients, but I know that here, like, we are checking in with our patients and we are educating them on how to safely utilize medications like that. Like she said, checking in on diet, on exercise, and, helping our clients to the best of our ability to safely use medications like that to get the best results.
I think it's really should just get more respect than it does because it's so hard. I've had 100-pound weight loss myself. I've been up and down. I've had 2 babies. I've been all the weights. It's not fun. When you are not happy with your weight and you come into an office and you say, I think I'd like to consider GLP, that is a really vulnerable place to be in. And it takes a lot of courage, a lot of strength to want to better yourself to be able to do that. And it's easy to be a little keyboard warrior and say, this is like, you're taking the easy way out. That's not easy. That's hard. These people really care about bettering their lives and they should get props for that.
Thanks for sharing that. That's so important. And honestly, I've never heard about those other benefits that you were speaking on. And I think it's actually super important for that word to get out to people who maybe are struggling with those issues and could utilize GLP-1s for that, not necessarily weight loss. So very important. Ladies, Emma and Paige, thank you so much for joining us. We do want our listeners to be able to follow you, book with you, all the things. Can you tell us a little bit about your membership process, your locations, and how they can find you on the internet and social media?
We have 3 locations currently. So we're in Dubuque, Iowa, Polk City, and Ankeny. And at each of our locations, we do offer membership programs. Typically, right now, we have a lot of massage and facial memberships, but I think that MedSpa is coming. Lexi's like, thank God.
Yes. Oh my God.
See us anytime. You can look at our social media. We also have information about our membership programs online on our website. We usually post some promotional things on there as well. So if you're wondering if we're doing any promotions, you can find those on there too. But we just are really, really grateful for you guys having us on, honestly, and being able to share because we're involved in a lot of community organizations. So we do nonprofits and community chamber events and things like that. And so they mean a lot to us. The patients in our communities mean a lot to us, as well as our team, of course.
We just want to thank you guys, honestly, for joining us. You guys are creating a space where people feel like heard, supported, and confident. And that care really, really matters in our communities, which you obviously mentioned you care deeply about as well. So we're just lucky to have businesses like Nova here in the Midwest and really appreciate the trust and education and the heart that you guys bring into everything you do. So thank you. We've been talking about this for so long. I'm just so glad it finally happened.
I know. I was very nervous about it, but
You did great, Dr. Emma.
You did great. See, it's not so scary.
But I really do appreciate you guys on a, just like an authentic level. I really do appreciate it because it's a really great opportunity for us. But also I just really love connecting with other women, and you guys are boss women. To be able to grow your platform to what it is and be able to speak and hear your voices get amplified, but also to be in a position to amplify others' voices is really special. And I think we do that on a level, but you guys do that on a very full level, if you will.
Not more
I don't think so at all, but thank you so much.
HIPAA, and you guys don't have HIPAA.
No, but we have Maddie. Maddie is basically HIPAA. She's like, don't say that.
Not more impactful, but that is why we do what we do. All right. Well, make sure to follow us for new episodes every single Friday and follow us at Wait You're Mad on Instagram and TikTok. Thank you guys so much, and we will see you next time. Bye.